Okay, so today we're going to be looking at these terms of gravida, para, and GTPAL. So these are terms used in obstetrics and gynecology to relate kind of the birth and pregnancies that a woman has, so their history of pregnancies. So first we're going to start off with gravida. So gravida is going to be the number of pregnancies equals the number of pregnancies. So this is regardless of any outcomes, but just the number of times that she has been pregnant. Para is going to refer to the number of births, so the number of births after 20 weeks. So before 20 weeks, that would be considered, so if the fetus exits the body before 20 weeks, that would be an abortion, whether a spontaneous abortion, meaning a miscarriage, or an elective abortion. So anything before 20 weeks would be that. But then we would consider para to be the number of births after 20 weeks. So this might be term births or preterm births that a woman has. And so para is often broken down into this acronym for TPAL. So then GTPAL is just referring to gravida, and then TPAL for para, and T is going to be term births. So the number of births she has from the pregnancies that are greater than 37 weeks. So greater than 37 weeks being pregnant would mean that it's a term birth. P is going to refer to preterm birth. So if the baby is born less than 37 weeks, this is a preterm birth. And obviously still more than 20 weeks, because before that, it's not really, the baby's not really going to be viable, and that's going to be labeled as an abortion. So A is going to be number of abortions. And this would also include things like ectopic pregnancies, because less than 20 weeks we're exiting the body. And then L is going to be living children. So how many living children does the patient have? And so basically this is just a breakdown of gravida, para, and GTPAL. And once again, remember gravida, so G is going to be gravida, number of pregnancies. And so let's go ahead and look at an example of this. So I have prepared an example here, which says that a 40-year-old female arrives to the clinic and has been pregnant for 7 months. After a series of questions, the patient says that she has 2 living children. One was born at 40 weeks and the other was born at 35 weeks. So if we go ahead and practice this, we have GTPAL. And I'll do the gravida and para in a second. So G, gravida, is going to refer to the number of pregnancies that she has. So let's go ahead and look at how many pregnancies she has. So a 40-year-old female arrives to the clinic and has been pregnant for 7 months. So we know that she is currently pregnant for, there we go, fix that a little better. So she's currently pregnant and she's been pregnant for 7 months. So that's going to be 1. And then let's see what else. So she has 2 living children. One was born at term, 40 weeks, greater than 37 weeks, and the other was born at 35 weeks, which is preterm. So we know that in total, she has been pregnant 3 times. She's currently pregnant, and she has 2 children, each of whom were 1 pregnancy. So that would be a total of 3 for gravida. Term births. So we know she has 1 term birth from here, 40 weeks, greater than 37 weeks is a term birth. And then she has 1 preterm birth, less than 37 weeks. And she does not have any abortions, according to this question. And she has 2 living children. So this would be G3, T1, P1, A0, L2. And so the gravida as a more sort of simple way to write this, gravida 3, and then G3. And then we have the para. So for para, because it's anything or birth that's after 20 weeks, all we have to look at is the T and the P. So term births and preterm births. So we have 1 plus 1. The para would be 2. So in order to calculate the para, you just look at the term birth plus the preterm birth, and that'll get you your para.